It's the fundamental principle for all healthcare providers to achieve their best medical practices along with their best performance. The patient safety goals, along with their solutions, are designed to prevent unintended errors and potential consequences from reaching your patients. Along with modifications and alternative approaches, these goals will ensure the well-being of all patients entering your facility. The Joint Commission, the World Health Organization, and the Institute for Healthcare Improvement, along with other organizations, have united to create strategic initiatives, professional campaigns, along with healthcare goals and standards to do no harm with regard to patient safety. These goals include two forms of patient identification: to prevent errors in medication, transfusion safety, wrong person procedures, or any surgical or non-invasive procedure. Read back patient information to improve communication. Communication promotes a continuity of care involving your patient's treatment. Rapid communication is necessary in a critical test or a critical test result. This relates to verbal or telephone orders or to telephonic reporting from the time of identification to the reporting of that result. The solution to this goal is to read back the information by the person receiving the information. Whether it's an invasive or a non-invasive procedure, reading back the complete test or test result is critical for a complete verification of information. The continuity of patient safety also includes having an improved effectiveness relating to communication among caregivers. This includes a standardized list of abbreviations, acronyms, symbols, and dose designations that are not to be used. And always follow a timeliness of report and a timeline when receiving critical test results and values to help achieve the continuity of care. Preventing gaps in communication is another important element to patient safety. Handover or handoff of information between patient care units or caregivers by following your facility's policies. This includes the opportunity for patients and family members to ask and respond to questions. Following your facility's communication policies will prevent inappropriate treatment or potential patient harm. The patient safety goals also involves the safe use of medication. This includes the control of concentrated electrolyte solutions that are used for injections. Annually review your facility's list of look-alike, sound-alike drugs. Label all medications, containers, or other solutions on and off the sterile field. Medication safety includes harm that may be associated with anticoagulation therapy and strategies relating to catheter and tubing misconnections to prevent wrong medication or fluid through an unintended wrong site. Confusing drug names is one of the most common causes of medication errors. It's your responsibility to provide patient safety by reducing the risk of healthcare-associated infections. Always follow your facility's hand hygiene guidelines. Follow your facility's guidelines to handle as a sentinel event all identified cases of unanticipated death or the major or permanent loss of function that is associated with a healthcare-associated infection. Follow standard precautions. Use additional precautions as needed. Doing your job well involves preventing healthcare-associated infections that may include a surgical site, a central line-associated bloodstream infection, or an infection associated with multi-drug-resistant organisms. Patient safety includes identification and outbreaks of influenza and pneumococcal disease. It's important to keep yourself and your patients healthy by following your facility's influenza vaccination protocol. Prevent the possible spread of healthcare-associated infections. The patient safety goals also include healthcare workers to accurately and completely reconcile medications across the continuum of care. Healthcare providers should encourage patients and their family members to speak up and be involved. Encourage patients and their families to communicate, to ask questions or share their concerns. If your job involves performing a procedure, ensure the correct procedure is being done on the correct body site to the correct patient. Follow your facility's preoperative verification process along with the patient's involvement when performing an invasive or non-invasive surgery. Communicate, document, and follow your facility's universal protocol if performing a procedure and patient identification policies. If your job involves anesthesia or a surgical procedure, you may need to reduce the risk of a surgical fire by controlling the heat source and take a timeout prior to the procedure. Follow your facility's identification of patient safety risks and a rapid response situation. Depending on your facility's patient population, this may include patients with emotional or behavioral disorders or addressing cultural diversity among your facility's patient population. Identification of patient safety and potential risks includes following your facility's fall prevention program. The goals for patient safety involve the recognition and the response to changes that may occur in a patient's condition. Always respond when a patient's condition appears to be worsening. Adhere to the single use of injection devices to prevent the spread of HIV, hepatitis B and C. Ask your supervisor if you have any questions regarding your facility's policies and procedures. On the forefront of patient safety is the performance of medication management. After determining the root cause of an error, policies may be redesigned to prevent future errors from occurring. Medication reconciliation includes assuring medication accuracy at transition points. It starts with the process for comparing your patient's current medications with those ordered while under the care of your facility. Along with the patient's involvement, you may include the patient's family members when you create a complete list of current medications. Encourage them to keep this list with them at admission or entry to be shown as needed. The medications ordered, administered, or dispensed to your patient while under your care should be compared to those on the list, including any discrepancies such as omissions, duplications, or potential interactions needing to be resolved. This complete list of medications should be communicated to the next provider or service when your patient is referred or transferred to another setting, service, practitioner, or level of care within or outside your organization. Your patient's accurate medication reconciliation list, complete with medications prescribed by the first provider of service, should be communicated to the next provider of service. The next provider of service must check the medication reconciliation list again to make sure it's accurate and in concert with any new medications to be ordered or prescribed. This complete list of patient medications should be provided to the patient on discharge from the organization. Saving lives involves patient safety goals and their solutions to prevent patient harm. Follow your facility's policies and procedures and universal protocol. Look-alike, sound-alike medication names. Patient identification. Communication during patient handovers. Performance of correct procedure at correct body site. Control of concentrate electrolyte solutions. Assuring medication accuracy at transitions in care. Avoiding catheter and tubing misconnections. Single use of injection devices. And hand hygiene to prevent healthcare-associated infections. Preventing, assessing, and reassessing healthcare-associated pressure ulcers, fall prevention, and encouraging patient and family involvement in their own care. Recognize and respond to change in a patient's condition. Reduce harm associated with anticoagulation therapy. Follow your facility's influenza protocol. It's important to remember that patients may not always be a reliable source regarding their own drug regimens. You may choose to include family members or caregivers when acquiring information. Compiling accurate information may require time with outside providers, such as the patient's pharmacist or primary care physician. There may be multiple handoffs to new caregivers and settings. For consistent compliance, know and follow your facility's policies and procedures. Within the sharing of information, it's your responsibility to house, share, and protect information. This includes your facility's consent process and safeguarding the confidentiality, integrity, and the availability of electronic protected health information. If you receive information unintended for you, or you make an error in sending information, report it. In healthcare, patient safety is in everyone's hands. This includes taking care of yourself by participating in your facility's influenza program. Taking care of yourself ultimately helps you take better care of your patients. Patient safety is an ongoing process to promote and improve performance. Be proactive. Speak with your supervisor if you have any questions or concerns. Lives can be saved, and injuries can be prevented.